unvaccinated arrivals has taken effect, and the rapid antigen testing for red zone arrivals has been stood up. It's the first day, so some teething problems are to be expected, some delays are to be expected, but we appreciate the patience of everyone at the airports today as this new phase begins. To the case update. The Northern Territory has recorded 3 new positive cases of COVID-19 in the past 24 hours. One is an international repatriation. The other 2 are from Katherine. The first of those is a 33-year-old woman. She is the mother of a student at McFarlane Primary School, and she has connections to a previous positive case. Her child has tested negative twice so far. She lives in Katherine East in the Bicentennial Road catchment, which may help explain the continued positive wastewater tests we've been getting there. However, Dr. Payne's advice, and he can speak more about this soon, is that there is highly likely to be other positive cases in that area. The second case in Katherine is a 67-year-old man. This positive result has only just come through, so I do not have any further details on that case yet. There were 2,517 tests processed in the Territory in the 24 hours to midnight last night. Incredibly, 1,170 tests were done in Katherine yesterday, an absolutely amazing effort, and I thank the community. In addition, 157 tests were taken in Rockhole and 15 in Warlpiri Camp. We don't have those test results back yet, and those results are critical. We expect to have them back later today, which will be really important for decision making. Another 36 vaccine doses were administered in Rockhole yesterday, 26 were first dose. The close contact numbers now stand at 423. Only 3 of those are yet to be located. 361 negative results have been returned so far. 1 new close contact site and a number of new casual contact sites have been added. The close contact site is the Katherine Centrelink office on Monday, that's last Monday, the 15th, between 9:40am and 10:30am. Katherine Centrelink, Monday the 15th, 9:40am to 10:30am. That's the close contact site. That requires testing and 14 days. The new casual contact exposure sites in Katherine are the Commonwealth Bank on Monday the 15th between 11am and 11:30am. Worley Health Service on 3rd Street on Monday between 9:15am and 9:40am. Coles Express on Thursday between 10:25am and 10:45am. Woolworths on Thursday between 10 and 10:20am. And again on Friday between 5pm and 5:20pm. And finally, Katherine Central Shopping Centre itself, broadly, on Friday between 4:30pm and 5:30pm. Casual contacts are required to get tested and stay isolated until a negative test is returned. Now to our 2 lockdown areas, Katherine and Robinson River. We are now in a position to transition Robinson River from lockdown to lockout effective immediately. A lockout means fully vaccinated residents are able to move about the community freely while wearing a mask, but must stay within the Robinson River area, which includes the surrounding homelands. We expect the lockout footing for Robinson River will continue in some form until the 1st of December, which covers a fortnight from when the last positive case was in the community. Robinson River has shown all Territorians how a lockdown can be done and won in the remote community. A highly vaccinated community, a high rate of testing and responding rapidly to an outbreak. The vax rate in Robinson River has clearly made a massive difference. For Katherine, unfortunately we are not in a position to lift the lockdown for Katherine today. It has been extended for a further 48 hours to Wednesday 6pm. There are a few reasons for this. The first reason, there are more than 1,300 tests from Katherine and surrounding communities that we really want to get the results back on, and that won't happen until later today. The second reason, the advice that there is still highly likely to be 1 or more positive cases in Katherine East that we have not found yet. There is persistent positive wastewater in that area. Our experience shows that persistent positive wastewater is a portent for more positive cases. We are still expecting more positive cases. I know this is not the news the people of Katherine wanted today. But I also know that you do not want to leave lockdown too soon, only to go back into lockdown straight after. I want you to be able to get out of lockdown and stay out of lockdown, which is why we need a few more days to get these results back and be more confident that the outbreak is safely contained so we can then transition to a lockout footing. Please stick with this. You are nearly there. I promise you, you are nearly there. Before I pass to Dr. Payne, I have an update on the vaccination mandate for the public service and what it means for the public service wages policy. Following the deadline for the first jab, the public service vaccination rate is 98%. There are about 400 public servants whose employment is ending due to their vaccination status. A small number of these are frontline roles that will be filled with new hires, but overall there will be a reduction in the public service of about 300 positions. Because our vaccination rate is so high, there are no impacts to service delivery expected from these people leaving their employment. The reduction in public service staff numbers delivers a saving to the budget wage bill of about $30 million a year. This means we can now revise and improve the public service wages policy offer that's currently on the table. This morning I have written to all members of the public service with a new 4-year wages policy. It is a $4,000 lump sum bonus in the first year and an annual $2,000 bonus for the remaining 3 years. The base rate will remain unchanged. Because some public servants are leaving their jobs, we can now improve the pay deal for the public servants who keep working, and this has no impact on the bottom line. We have been very clear from the start, any alternatives to our wages policy must still fit within the existing funding envelope. The budget cannot afford out-of-control wages growth, and we cannot accept it. We have spoken to unions this morning. They were the first people briefed. After that meeting concluded, I wrote to all public servants, and now I am informing you. If there is a better idea that sticks to the funding envelope, I am all ears. If the unions propose an alternative that is more expensive than this, then the only way to pay for it will be with job cuts, and I will expect them to include in any proposal what jobs they think could be cut to pay for it. But I hope the new offer can be supported because it means more money without cutting more jobs, and the budget can afford it. So I'm urging all of our hard-working public servants to support this deal when it comes to a vote, because it's a deal that puts more money in your pocket and protects your job. Thank you.
Thank you, Chief Minister. Thank you for coming. Yeah. So, as you've heard, we've got 2 new cases in Katherine. They're both in this catchment area that we've been watching closely for the last few days, in the bicentennial catchment area, which may partly explain why we continue to get positive results for the wastewater there. We expect, though, as the Chief Minister has said, that there will be other cases. It's unlikely that there are only 2 in this catchment. So I'd ask people to please come forward and help us here. We need people to come forward now to get tested. We will be going in that community door to door to try and identify, to help people to get tested. And the other thing is, across Katherine and across the region, vaccination is still the most important thing for us to do. We must get people vaccinated. I'll go to Binjari, thank that community again for their cooperation. We haven't had any further cases there today, fortunately, but we are expecting more. They are in a hard lockdown to protect them. I was concerned to hear that there were some people left that community. The Territory Controller will speak about that. But please stay where you are. This is a critical phase that we're in, and if people are going to move around, it will put others at risk. I'm delighted that we are, excuse me, we are able to ease the lockdown in Robinson River, and although that's not a direct reward to that community, it clearly is a consequence of their exemplary behaviour in terms of vaccination, but also that they have remained in lockdown. So I'd thank them for that. And lastly, just to acknowledge again the staff and all of those who have been working so hard recently. And I have a brief message from Dr. Heggie. Dr. Heggie, when you last saw him in the media, you will know that he was very distressed at the thought of the loss, excuse me, the loss of elders, and I just want to convey the message from him that he remains very concerned about that, and his appeal, and my appeal with his, that everyone support us in this by getting vaccinated. Thank you.
Good morning, everyone. Unfortunately, we had about 8 residents from Binjari leave there late yesterday. Under the cover of darkness, they walked through a backtrack and ultimately got into the Katherine area. We managed to come across them and ultimately return them. 6 of them were adults, and they've now received $5,024 fines. To those people in Binjari, the compliance has been really, really great by the large proportion of you. If you need food, if you need anything, please make contact with the police officers and the other government staff that are on the ground. We will try and facilitate whatever you need on the ground. The urgent message is please do not leave. You must stay within the Binjari community for the time being until we give you further notice. So that also applies to the Rockhole community. More generally, the testing continues on the ground there. We've also been to Walpri Camp, which is just a mitigation as it relates to the bicentennial wastewater. We're continuing to set up the testing facilities to ensure all those in Katherine, and with the new announced exposure sites, encourage anyone who's been to those sites to come forward and get tested today. The response from the Katherine community to date has been nothing short of exceptional. We thank you very much for turning up and getting those tests yesterday. We do continue to urge you, though, to come forward and get the testing, particularly the vaccination, particularly Aboriginal people in the Katherine area. We know that that's an area that really needs to have a lift in the vaccination rate, so please help the rest of the Katherine community to get over that 80% double vaccinated status so that we can look to other contingencies in the future. We're hopeful that the work you continue to do over the next 48 hours from 6 p.m. tonight will get us into a better posture, but we want to make sure that you are not going to be flipping in and out. We know how much of an impact that has, so we really want to drive this through for the time being so that we can get you out of this situation as it currently presents. Robinson River, again, fantastic collaboration continues on the ground there. The lockout, I want to be clear, you cannot leave the lockout area, so the police will still be at the exit of the community and the entry to the community to make sure no one's coming and going. It just means that you, if you are double vaxxed, free to move within the community. Make sure you're wearing a mask when you're doing that. It's an acknowledgement that the testing from day 5 has come back negative, and that's really, really encouraging. But bear in mind, we also moved some close contacts from Boral yesterday into the CNR, so we're awaiting some testing results there. So not out of the woods yet, but encouraging steps, and we feel it's commensurate that the lockout is now in place for you. More broadly, there's a lot of work we're still doing, obviously, in Binjari and Rockhole. We are literally looking after all the people on the ground there, making sure there's care packages, food provisions, access to power tokens, all of those things are continuing. Again, my clear message to you is if you need assistance, put your hand up, let us know, and we'll do our best to facilitate that for you. Thank you.
Chief Minister, AMSAN has called for a state of emergency to be declared to protect remote communities. What do you say to those calls?
We declared it 18 months ago. We are in a state of emergency, officially, legally, by every possible definition we have in the Northern Territory and by every legal power we have. We are in a state of emergency. I guess we've been in this position for so long, I can understand that sometimes people forget that that's where we are. That's where the Chief Health Officer's powers come from, and how we're directing our resources. One update, if I may, there are now 4 people in Royal Darwin Hospital, not 3. I'll just pass briefly to Dr. Payne to provide a clinical update on those 4.
Thank you, Chief Minister. Yes, so I did report yesterday on the lady that was unwell, that we were concerned about, but had received 1 vaccination. She is improving. She's no longer requiring oxygen, so we're delighted to hear that progress. One of the new admissions is a man who had underlying health conditions, who was the first person identified in this most recent cluster. He has had to be admitted to a hospital, and we wish him well, and obviously receiving the best of care. The lady in her 70s, who we spoke about yesterday, is still in hospital. She's not yet requiring oxygen, which is pleasing, and so we wish her well, and she's getting the best of care. And there is 1 other healthcare worker that you're aware of that is still in hospital. So we now have 4 out of a total of 37 cases are now in hospital. Thank you.
What can you tell us about a fatality inside Howard Springs last night?
Yes, I was made aware of that this morning. It's completely unrelated to COVID, and that is clearly being investigated. And I think at the moment there wouldn't be appropriate to say anything more.
Just if we can clarify on this health worker, if we can get their age and this health worker's a man or a woman?
Is a man, yes, and in his 40s, I believe. I'd have to check my notes, but I won't say any more detail than that because the person can possibly be identified. But we give him, we acknowledge his service. He caught it in the course of that service. Thank you.
Are any of those patients in ICU, or are they just in...
No, none of them are in ICU. So, as I've said before, we use ICU as a last resort, but of course, patients may require oxygen.
AMSAN's also called to be involved in high-level discussions around lockdown, lockout, and basically responses to remote communities in particular. The Chief Minister's office said that this was a decision made by the CHO. Given you're acting in that role, would you be welcoming them being included in those level discussions?
Yes, I always do, and we have a public health advisory group that does have representation on it. We usually meet every week. We haven't actually been able to during the outbreak, but it's certainly from my office and from the position of the CHO, we very much welcome their advice. Their advice is sought on a whole range of things, particularly around vaccination, which we have taken a great deal of advice from, but also on the management of the outbreak. And so I very much welcome that. And I'm in regular contact, even outside of those meetings, with various representatives, but I'm very open to further.
Is it appropriate to have not met with AMSAN, given that this is an outbreak that is disproportionately affecting Indigenous Australians and disproportionately affecting Indigenous communities? I mean, surely they're the first port of call.
Yes. Well, I don't directly meet with AMSANT as an organisation. I meet with representatives through the public health forums that I create. It's not for the CHO to actually meet formally with them, but as I say, I'll just reiterate that I'm very open to their advice. Their advice has been sought throughout this pandemic since the beginning.
Why have the formalised weekly meetings not continued, given that the critical role that they could play?
Sorry, would you repeat that?
Sorry. Why have these weekly meetings not been continued during the current?
Well, I do call these meetings when I feel, one, when I'm able, but also when I feel the need to ask for particular advice. I actually will call a meeting this week. We will have a Wednesday meeting. We don't always have them weekly, but I do it when I increase the frequency when there are things to seek advice on.
Do we know how many close contacts are currently in Howard Springs?
Close contact, I don't have that number, but it'll be in the of the order of 300. It's a significant number. Yeah.
And the
Below 200.
Sorry?
Just below 200.
Oh, it's just below 200.
The population at the moment in Binjari and Rockall obviously is changing a lot, given people are being transferred into Howard Springs. Do we know how many people are still there, and I guess how many people are yet to be tested for COVID-19?
I think I'll ask the Territory Controller to speak to that. Thank you.
As of this morning, we had 189 people who were linked to the Katherine cluster and the broader remote community clusters, including Binjari and Rockall, who have been housed there. We've got a aircraft on the ground in Katherine, or certainly just about due to have landed there. That's got capacity to bring up to another 60 close contacts. We had just over 40 ready to be departed this morning, so that number will obviously grow into the 230 number, I would suggest, by the course of today. Of course, the two positives that have been identified overnight, they've got some close contacts, particularly family members, that will make up part of that cohort this morning. So we've been moving a lot of individuals across some pretty big parts of the Northern Territory, but again, people have been generally compliant and patient with that.
Actually, can you confirm the fatality inside Howard Springs is returning international?
Yeah, it was an international repat. Obviously, they were a 77-year-old individual. We're just looking at whether they had any existing other issues, but certainly the initial advice is not indicating that it was a death related to COVID.
And in terms of the housing situation, obviously this lockdown tells people to not leave their home or yard. That could see, I guess, situations where you have a lot of people isolated in one home. How are police coping with that? Are there any strategies to perhaps take a bit of a burden off singular households that may become or are already overcrowded?
Well, of course, I think we're upwards of 38 have been removed from Binjari alone as close contact, so that certainly would have helped with some of that overcrowding issue that presented. But again, what we've made sure is that power supply is being continuous, that people are getting the adequate provision of food, the care packages, the constant engagement is occurring. Unfortunately, humans are humans, and sometimes they don't always adhere to what we would like to see. The footprint of Binjari is relatively sizable as a sort of community just out on the outskirts of Katherine. It's a fair walk to get into town, so again, we just really need people to stay there. But the police forward command post is based in Binjari. There is access to police. We've got good communication on the ground, and again, the community are our greatest sentinels in making sure that people are compliant.
Does that mean that the power that might have gone out because people have run out of money on power cards has been compensated for the government?
So over the weekend, we had a non-disconnect policy in place to ensure that nobody was left without power. We understand there was 2 homes that ultimately had no power, and we had power and water activated, and that got treated. I'm still not clear on why that power actually disconnected, whether it was a short or whatever the case may be. Suffice to say that they acted very, very quickly once made aware of it and put that back on. As part of the care packages, we've been providing power tokens to those that need them, and we'll continue to work with them. In essence, we're providing as much support as we can to those communities for this period. The lockdown is to the significant level that it is.
In terms of vaccine,
In terms of the forward command post, how many police and ADF forces do you have deployed out to Katherine?
I surged an additional 30 plus NT police officers alone down into the Katherine area, as well as we've obtained about 40 ADF currently who are going to be assisting with the provision of transport for people to get tests, but for Binjari and Rockhole specifically, to support us with the provision of dropping off the care packages and the like. So on top of the existing resources there, additional Australian public sector, we've got 10 public servants from the Australian Public Service who are going to join us through the course of today. We've got additional Katherine public servants who are based there in the lockdown, who are double vaccinated, who are providing additional support to our RAT teams to facilitate testing lines and the like. So it's been an enormous effort from people who've been asked to come forward.
is there capacity to surge beyond the current workforce that we've got deployed there at the moment?
So I just missed the first part.
Is there capacity to surge beyond what the workforce that's been deployed there at the moment?
There is. I've got an additional request with ADF at the moment that will certainly help mitigate some of the potential pathways for people to move. That'll just help me spread my police in company with some ADF personnel just to really focus on the compliance and the education. I'm not requiring ADF to do any enforcement. That's a role that we'll continue to pick up, but we really want to, on the basis of improving people's health and trying to mitigate any spread from those who are leaving those places, we want them to be contained so that Katherine and surrounds are not in lockdown for far more extended periods than they need to be.
Have any fines been issued for people or businesses not compliant with the vaccine mandate yet?
No, not today. As I say, what we've ultimately had is when we've been hearing stories and rumours, we've been going to do some audits on some of those places, and compliance has actually ended up being in accordance with the CHO directions, so that's very pleasing.
We're talking about an additional 80 people deployed to Katherine and potential for a surge as the outbreak continues. What is the housing situation for those additional forces?
So we're using commercial accommodation where it's available. Obviously, Katherine being in lockdown, not too many tourists will be moving in and around there, so that'll obviously be of some assistance to business. We know the tourism sector in particular is hurting through these periods of time, which only goes back to why we need compliance, and we really need people, particularly in these specific lockdown areas of Binjari and Rockhole, to stay where they are so we can ensure that the day 5 testing ultimately gives us a stronger indication that we've trapped it and removed those who are likely to be positive into the CNR.
There's been a bit of confusion about the mask mandate in the West Daly and Roper Gulf LDAs. Sorry? Did you say Big Daly? Okay. Well, good.
Sorry. Given that we do have tourism sectors that are being used as part of the COVID response, why are we moving people on planes to Howard Springs when there could be this potential for on-country housing?
So I don't suggest that there would be potential for on-country housing at the moment. We've spoken about the likelihood of overcrowding for these places. The fact is we're moving very, very swiftly, and the plans were always in place that we would surge to ensure that close contacts and families were well supported, that they had the relevant medical provisions available to them almost immediately if they develop any symptoms. The CNR is world class, and we should be extremely proud of that. And the fact of the matter is, what we've demonstrated is our approach to date is mitigating the spread. So, you know, you'd be critically aware we had 9 positives in Binjari in a relatively short period of time, and fortunately since that point in time we've had no further positive spread. I think that's a pretty good tick to a very effective model.
Chief
Given that
Minister.
the plan was to move close contacts to Howard Springs, did that at all influence the decision to move forward the at-home quarantine plans?
No, that was completely separate.
Chief Minister, spoke to the Prime Minister earlier on over the weekend. Have you spoken since? Have you got everything you want from the Prime Minister in regards to responding to this outbreak?
We've had a good response from the Defence personnel. We've had a response since, again, from Defence. We may still keep talking with the Prime Minister about further help, but at this stage the PM's basically said we're here to support, and so at officer level we're having those conversations. I'll probably go back to the PM only if at officer level we hit an obstacle. I also want to go back to a previous answer from the Chief Health Officer and add to it. And I want to thank him. I think he was a bit too modest in some respects in what he was in how he explained what he was doing. AMSANT are an extremely important peak body, and they're a rep body. Their members are the Aboriginal Community Controlled Health Organisations. That makes sense. In the Katherine region, Worley, Katherine West, Sunrise, Archos who report up to, or members of AMSANT, obviously. We are working daily and talking daily with those Archo groups. So while that formal meeting of AMSANT may have not been able to proceed as normal during the lockdown decisions, not that we haven't been talking with Archos and working directly with them. So I know the CHO's actually in constant conversations with the AMSANT members, if that makes sense. So it's about obviously where you are in this crisis at a different point in time, who you most need to talk to. A lot of work's been happening, a lot of conversations been happening, a lot of data information has been shared, a lot of people are on the ground. I think yesterday I gave a shout out to Worley, in particular Pete, who've been helping on the ground. So we're very grateful to AMSANT and their member organisations and all the support they've been giving us and all the conversations we've been having.
The
I
Prime
suppose
Minister's
the
been talking about international borders this morning. What's the Territory's position and what's going to happen on the 20th of December? Who will be allowed in? What happens with international students?
Well, it depends a little bit, obviously, on the Australian government's decisions. They're responsible for the borders. I can talk to our quarantine or situation here in the NT. Our international decision mirrors our domestic decision, how we handle people. So you have to be fully vaccinated, come from a green zone, etc. So there'll be some work from the Australian government about how they identify places. As I understand, December 20, the only commercial flight into Darwin's from London, and that's been going for a little while. We know how that works. So essentially, if you're an international student wanting to come in, we'll work with you about entry and all that, and the rules are the same as domestic. So it depends on your vac status. Is it acknowledged or recognised by the Australian government as a genuine vaccine? And then that essentially sends you in two different directions.
With your latest offer to the public service, you say it's because you've got a reduction of 300 public servants. But the recommendation of the $1,000 cap came at a time when there were 2,000 fewer public servants than you have now. So how can you justify that 4,000 plus 2,000 plus 2,000 plus $2,000 increase when we're 2,000 public servants in front of where we were when that recommendation was made?
We've had a pandemic. And so, for example, just in the Department of Health, we have 700 additional positions that have been created purely to respond to the pandemic. So there has been a surge in temporary positions to deal with the pandemic. It's all been in the front line. Since 2016, if you look at our breakdown of additional staff, 1,600 are in health, so mainly the pandemic and Palmerston Hospital. And then teachers and police makes up the remainder, essentially, and that's been all our growth has been frontline services. We have now put a cap on the wages bill rather than staff positions. We've put in place now directions around how we can handle that and how we can hold CEOs to account against the wages bill. With these 300 positions going, that creates a gap in our wages bill that we can now essentially reallocate to the staff who are still here and still working for us. I'm very grateful for that. So obviously done this in advice of Treasury about the operating balance that we've got and how you redistribute the money. But there's obviously been significant positions created purely to respond to the pandemic.
You're still going to be a long way behind where you were in 2019 And that's only going to get worse in the future now, isn't it?
So this obviously tracks with our wages bills that we've already signed off at the last budget. So this is all done within our budgeted numbers and everything that's on the forward estimates. So this doesn't put us over our forward estimates or our budgeted numbers.
Chief Minister, there was a time in Parliament where you called people anti-vaxxers because who were vaccinated because they had opposition to the mandate. You called Federal Senator Malandiri McCarthy a champion of the vaccine and anti-vaxxer because it wasn't 100% support of your mandate. I wonder, do you think at all that your rhetoric around calling people anti-vaxxers, some of whom were vaccinated, has had an impact at all on vaccine take-up in parts of the territory?
No, and I'll repeat it. If you are anti-mandate, you are absolutely anti-vax. I don't care what your personal vaccination status is. If you support, champion, give a green light, give comfort to, support anybody who argues against the vaccine, you are an anti-vaxxer, absolutely. Your personal vaccination status is utterly irrelevant. If you campaign against the mandate, if you campaign against people being vaccinated in vulnerable settings, teachers in classrooms, I want to be really clear, at that point in time, people were actually supporting the idea of a teacher being unvaccinated in a remote community classroom with kids who cannot be vaccinated. I reject that, Eileen, I still reject it. And if you are out there in any way, shape or form campaigning against this mandate, you are absolutely anti-vax. If you say pro-persuasion, stuff it, shove it. We are absolutely going to make sure as many Territorians as possible are vaccinated. That is our best protection against this thing. And if you look at the Doherty modelling that's only come out since, that says if you double dose 80 in remote communities, 5 and up, I think you'll see our vaccine mandate is absolutely crucial to protecting lives, particularly Aboriginal lives. And I will never back away from supporting vaccines. And anyone out there who comes for the mandate, you are anti-vax.
And Chief Minister, as well, as we grow to opening up with our home quarantine plan and then December 20, should we become, I guess, a little bit more comfortable with expecting cases within the community?
I think the Cho has spoken with this. And I've spoken to this too. I'm going to pass to Dr. Payne to add to this because I think this is a very important message, and Dr. Payne said it very well the other day. You are absolutely going to get COVID, and you will get COVID either vaxxed or unvaxxed. That's the two choices you have, and I'd much rather you get COVID vaxxed. Dr. Payne actually put a timeline on that the other day. He said, I think basically within a year, everyone's guaranteed to get COVID. I might ask Dr. Payne to come up and repeat that message because I think everyone should be aware COVID is endemic in the world. The Territory is one of the last places to experience COVID as an endemic thing. We're holding out as long as we can. Every day without COVID is a better day, absolutely a better day. But at some stage, COVID will come and everyone's going to get it. Dr. Payne.
Thank you, Chief Minister. Yes. So we're in this very difficult transition that everyone in Australia is going through. Some states have gone through it, if you like, through a huge wave in new cases and come out of it the other side. We're trying to avoid that. And our only way of doing that is to get to high enough vaccination rates so that the cases, when they come, which they are, they're coming, as the Chief has said, and I repeat, at some point we will all be exposed to it. And then the choice is, whether you were vaccinated or not. Don't leave it too late. You don't want to get it unvaccinated. That's very clear. So we are now in this difficult phase trying to manage it in a way that reduces the impact on our community and deaths and morbidity, but also on the health system. So that's the challenge we face. We are going to have to expect that. It's going to become endemic. There will be cases in the community. But as you can see with the way we're managing what's happening in Katherine, we're not at that stage. We have to respond vigorously to those outbreaks. We've got 4 people in hospital from that small outbreak. It's small on the scale that we've seen around Australia. There's 37 cases in it. So we can see it unfolding in front of us, and our approach to it is to try and strike a proportionate balance in our measures, the border controls, but also our public health measures and our contact tracing.
And can I just ask, over the weekend there was a degree of, though cautious, some optimism around where we were with COVID in this current outbreak. What's the prognosis today? What should the public be taken away from these 2 new cases within the community?
I'd say our situation is stable at the moment. We're not seeing more cases yet in Binjari, but we will see them. But our controls in place in Binjari and Rockhole are reasonable. They're strong. They're very strong measures. In Katherine, we've had a few further cases. We predicted that. You've heard us say that. We knew there would be more cases. We've got to hunt those down with vigour, as we have done in Binjari and as we have done in Robinson River. I think our approach has been, and of course all credit to those who are involved, has been extraordinary, enormous effort across a number of agencies. And I think if we can hunt down those cases in Katherine that we expect to see there, maintain our current controls for a reasonable period, I am optimistic. I am very hopeful, but each day we'll let you know where we're up to, and may need to adjust it. But obviously we've done incredibly well in this current outbreak.
Just a quick question. How many rapid antigen tests have been secured, given that we are seeing it being deployed at all airports?
Yes, I don't have the figure, but it's tens of thousands. The last figure I heard was 50,000, but we're constantly procuring further rapid antigen tests.
Thanks, everyone.
Commissioner, while we have you, do you have an update on the alleged gunman in the Narrows from last night that you would be able to?
So yeah, there was an incident in the Narrows last night. Our police responded, set up an appropriate cordon, engaged with the individual involved. They agreed to the surrender plan, so that arrest was effected quite safely. We recovered the firearm, and that investigation will continue, and it appears that charges will follow.
Do you know if he knew the people he was threatening, he or she, allegedly?
We certainly know there was a disturbance there where there were some threats to other people, but of course that'll come out in the fulsome of time once we complete the investigation. Thanks everyone. Cheers.